First oral question, Baroness Bull.
My Lords, I beg leave to ask the question standing in my name on the order paper and declare my interest as a Vice Chair of the APPG on eating disorders.
We are working to ensure that people of all ages with an eating disorder or who are at risk of developing one have access to the right support in the right place and at the right time. We are delivering on the ambitious transformation plans outlined in the NHS long-term plan and Children and Young People's Mental Health Green Paper, and provided additional investment this year to address pressures arising during the pandemic.
Does the Noble Lord the Minister agree that improving support for eating disorders depends on improving understanding of their causes, prevention and treatment? Eating disorders account for 9% of mental health conditions in the UK, but receive only 1% of mental health research funding. This leads not only to major evidence gaps, but to fewer researchers, less research, and the ongoing stigmatisation of the illness as a niche concern. So will the Minister's Department consider working with the NIHR on a long-term eating disorder research strategy to break this underfunding cycle, as it has for other health challenges, so that more effective support can be targeted on their prevention and treatment?
Well, first of all, can I start by paying tribute to the Noble Baroness Bull for all the work she has done in this area and making sure that we are all aware and keeping this issue on the agenda. In answer to a specific question, the Department has invested nearly 110 million in mental health research, including research on eating disorders through the NIHR, as she mentions. This includes the Eating Disorders Genetic Initiative, also a systemic review led by the Evidence for Policy and Practice Information and Coordinating Centres, and UKRI has announced funding for a £3.8 million study on eating disorders to inform prevention and early prevention in young people. This research is being led by researchers at King's College London and the University of Edinburgh.
My Lords, the latest NHS data shows a continuing increase in the number of people being hospitalised for eating disorders, mainly in the 18 to 39-year age group. Yet there is still no adult waiting time standard for people with eating disorders, despite knowing that access to quality community care can reduce the number of hospitalisations and indeed unnecessary deaths. So when is this government going to introduce an adult waiting time standard for people accessing treatment for serious eating disorders?
Well, we are, as you can imagine, because of the pandemic, sadly, that the waiting times have gone up, but we are making sure we are doing as much as we can to address that. And also, longer term, focusing on prevention, not only cure, we're also making sure that we are able to understand better all the various forms of eating disorder, because it's very simple to lump them all together, but there are different elements to them, and you can distinguish between them. And then we will hopefully be able to tackle that as much as possible. Thank you.
My Lords, given that many young people with eating disorders find it very difficult to seek help and identify themselves, what specific additional resources are being provided for schools to provide help and support for young people with this actual life-threatening illness?
Well, the Noble Baroness raises a very important point about how we identify young people, children and young people who are suffering from these disorders or who are maybe a few steps away from this. And we do know at schools there are programs with the Department of Education, but also our department, in terms of tackling mental health issues in schools, identifying pupils, encouraging pupils to come forward, talk to their counsellor in the school, and make sure that they are signposted in the right place to make sure we can tackle their issues.
My Lords, what Minister mentioned that eating disorders don't always present in the same way. He will be aware that some fluctuate so that they move from chronic to acute over a period of time and back again. When people are seeking treatment for eating disorders, at the moment, those that can afford it are not even able to access treatment in the private sector. But if they were able to, would they then be able to access NHS treatments at a later date, for example, should they not be able to afford to continue with private treatment?
Well, I think Noble Baroness raises a really important point. In fact, it was an issue that was raised over the weekend on actually an individual case. And I know we are always advised as ministers not to get involved in individual clinical decisions, but one of the issues in this case was the fact that there was a child who hadn't yet got a bed, and what had happened was that the parents wanted to take them out to private until a bed became available. And they were told that if they went to use the private sector, they would be put at the back of the list. I'm trying to get more details on this to make sure. I mean, it seems a lack of common sense, and I want to make sure or understand why that is happening. And I still haven't had an answer yet.
My Lords, would the Minister agree that
what the government is doing with regards working with industry, and particularly the fashion industry, because at the moment there is great emphasis on size 0 models, which can't really be helpful when linking it to the question my noble friend asked previously, because it's not a good image, setting the right image for young people, and that's for boys and girls.
Well, the issue that my noble friend raises is very important in terms of the issue of poor body image. And the government is addressing known risk factors through both universal and targeted interventions. At the top level, it's looking at the Better Health Every Mind Matters content, which focuses on supportive mental health and well-being. Poor body image and low self-esteem are topics that are addressed. Also looking at what pupils expect, and also looking at the Prevention Concordant for Better Mental Health programme, and also working as part of the anti-obesity strategy to make sure we get the right balance, because sometimes when you focus on, for example, information on packets, it can have an unintended consequence to those who have eating disorders. And every time we are looking at some of those labelling, we have to make sure that we've addressed those unintended consequences of people with eating disorders, so that they don't feel, or they don't feel, they don't react in a negative way to it, and perhaps indulge in behaviour that we don't want to see them indulging in.
My Lords, the Royal College of Psychiatrists has warned that the hidden epidemic of eating disorders has surged during the pandemic, with many community services overstretched and unable to treat the number of people who do need help. So will the Noble Lord the Minister publish data about the number of people who are waiting for eating disorder treatment in order to better understand and meet the scale of the demand? And will he deliver a workforce plan to tackle the staff shortages in eating disorder services so that it may be possible to treat everyone who desperately needs this help?
Well, I thank the Noble Baroness for raising the issue of the backlog as a result of the pandemic. And we have seen, when we look at eating disorder services continue to face an increase in demand, especially as a result of lockdown and the mental health impact of lockdown. The number of the young people and young people entering urgent treatment has increased by 73% between 2019, 2020 and 21. And the ones who are waiting for treatment has also increased from 561 to 2,083. To meet these, to make sure that we meet the standard and get the waiting times down, we've invested extra 79 million extra this financial year, and working with systems across the country to see how we can make sure that we address young people and adults who need access to this treatment.
My Lord, would the Minister agree that it is a very, very serious condition that 71% of the British people over the age of 30 are obese or overweight? And the problem with this is that it interferes with the immune system, which makes them much more vulnerable to all kinds of diseases, not least infections. And if we want to come to deal with the next pandemic now, we have to get people to reduce their weight so it doesn't interfere, the obesity doesn't interfere with their immune system.
I think the question from my noble friend highlights the difficulty and how it's quite a sensitive area, and you have to be very careful how you address issues of obesity. So, for example, it's quite right that we wanted to get the rates of obesity down, because they do lead to a number of other conditions that we've discussed in many times here. But one of the things we always have to look at is the unintended consequences of any laws. And one of the possible unintended consequences is when you look at some of the measures to tackle obesity, like food labelling, etc., what happens, it might affect people who have got eating disorders. So every time we look at the obesity strategy, we make sure that we consult with charities who deal with, look after people who've got eating disorders to make sure we've got the right balance. We won't always get it perfect, but we'll try our best.
My Lords, anorexia nervosa is one of the most pervasive of mental health disorders, and can sometimes only be successfully treated in specialist inpatient units. So could the Noble Lord the Minister say what plans there are to grow the number of specialist inpatient beds? Because in 2019, the government promised that people would not be sent to out-of-area beds after 2021, and I don't believe that that is currently the case.
Well, as I'm sure the Noble Baroness will appreciate, the fact is we did have a strategy to tackle this. Some of it has been knocked back a bit by COVID and having to tackle the backlog, but we are looking at how we can make sure that the strategy gets back on track as we emerge from a lockdown, hopefully, less pressure on the NHS.